There are mounting calls for accountability on the reported collapse of the Gender-Based Violence Command Center. The Social Development Department, however, maintaining that the center remains operational. Just yesterday, on this show, we spoke to the Social Development Deputy Minister, Hendrietta Bogopane-Zulu, who made it clear that that call center is as good as collapsed, basically calling for the contractor to be changed. But the minister, on the other hand, says these are just teething problems. So let's speak now to Dr. Lesley Forster. She is the Executive Director at Masimanyane Women's Rights International. Dr. Forster, good morning to you, and thank you very much for your time. When two department heads, this is the minister and her deputy, are sitting at opposite ends of what this GBV command center ought to be, what do you know about the status of this center?
Well, I'm unaware of the fact that it has collapsed totally. I know that it's been operational, but I'm also, we have deep concerns as well about the way in which DSD is managing GBV cases. In the Eastern Cape, many of the social workers from the Department of Social Development have not returned to work since COVID. Due to problems with, their buildings. So there are pockets of excellence within DSD, and there is a large gap in many of the activities or the services that they're supposed to provide. So, from our perspective as civil society, we are not happy with the way in which the department is dealing with gender-based violence, and they are one of the chief, people or chief departments responsible and accountable for gender-based violence. But there are many levels at which it is dysfunctional. So I think that's very problematic and something that needs to be looked into. I'm unaware of the fact that the command center is not functioning optimally, but as I'm saying, it wouldn't surprise me because there is no consistency in the service provision that DSD provides, and we need a lot of work to make that, to ensure that they are able to provide the services that they are responsible for.
So let's talk about areas of concern, Dr. Forster, areas that need improvement, because if government, through the president, the leader of this executive, is going to declare GBV as the #1 pandemic in the country, surely departments such as the one directly responsible, they've got to pull up their socks.
Absolutely. And I mean, this is about, the summit we had last year spoke about how important it was for these departments to all pull up their socks and to all respond at appropriate levels to the pandemic that we had, which is gender-based violence. But we're not seeing those changes. And as I'm saying, that what we see is that there are centers of excellence but they're far removed from the general reality of what, of accessing those services from social development. In the Eastern Cape, social workers have not returned to work. I mean, that has a massive, massive impact on the delivery of services and the ability to provide the kind of response, care, and healing that communities need. And we struggle with this. And I mean, I'm sure that this is similar across the country. I don't know whether you know this, but last year, DSD returned something like 15 billion rand to Treasury because they had not used it. And that's an indication of their inability, their lack of capacity, their lack of political will to actually, ensure that communities get the services they need, because you can't return such a large portion of money and claim to be working effectively. So it's not The department needs an overhaul, throughout all of the provinces to ensure that the services are available to communities. And right now, that's not happening. That I can tell you for sure. And I'm in touch with other community, based organizations, civil society groups across the country working on GBV. All of us have some kind of obstacle to, the service provision or service delivery. And sometimes the services that they have to provide is the support of NGOs, and that's not working optimally either. So NGOs are the real people on the ground providing the services. DSD is supposed to support that, and often that's not happening. I mean, we know this for sure, across the country. There was a shelter in Dava this week, and they were talking about the lack of service provision. So all in all, we have the political commitment from the president. There are some initiatives that have been put in place or have been put in place to address gender-based violence, but it is still ad hoc, inconsistent, and not properly resourced. That in a nutshell spells out where we are in terms of gender-based violence in this country.
Dr. Forster, you mentioned something quite striking to me, and that is there is a political commitment from the office of the president to deal with this and deal with it in a manner that basically ensures that victims are taken care of. But let me paint this picture for you. The deputy minister on this very show yesterday tells us that the command center used to be in an area where it is safe and secure. The victims could come in, and the picture she painted was that this would be an environment where they could possibly even reside for a number of days while they are undergoing this therapy, if you like, or this counseling. Then she says, when this new contractor took over, the center was moved, and her words are, it was moved to a township where the victims are brought by their partners or husbands, and these could be people that are potentially their abusers, and they wait across the road to say, you'll find me here when you are done. That picture I've painted to you talks to now the people that President Cyril Ramaphosa gives instructions to say, make sure that this is working. So if those two political heads are fighting or are not seeing this situation in the same manner, surely there needs to be a change at the top, doesn't it?
Absolutely. I think what you really suggesting here is that there is a misalignment within the department around the issue of gender-based violence. So the minister as political head has a strategic role to play, a strategic role around ensuring the right policies are in place and that those then filter down. The deputy minister may be more at an operational level, so she would have, or he would have, a different perspective on how the instructions are actually being carried out. So I think it's not unusual to have those different perspectives, but there should be more alignment with what the minister understands to be happening on the ground and what is actually happening on the ground. And I think that's a communication problem. It's a problem of, having roles and responsibilities clarified, but also communication. There's very poor communication if one says one thing and, on the other hand, something else is happening. I think what's also very important that you've said is that a new service provider was brought in. And I think that sometimes service providers are selected. We know this happens a lot across the country, who do not have the training, the skills, the capacity, or the analysis as to what is needed when setting up a command center. If the command center was set up for a particular community to access it, then that's fine to move it to that community. But if it's supposed to be accessible to a much broader community, then the location for that needs to be considered. And I don't know whether they've actually consulted enough with the service provider to ensure that they understand what the requirements are, whether that service provider is from civil society when they're engaging with civil society, because processes like this need a lot of input to get the right kind of fit. What you're saying to me is that the command center currently is not fit for purpose. Yeah. And that's something that I will raise with the national groups to say, let's have a look at this and, review it. This is the first time that I've become aware of it, because I think each of us that work in our particular provinces, we have our networks. We know what's happening if you ask us about about that. And because we talk with other groups, we kind of have a sense of what's happening, in other provinces, but we don't have this perspective as to the change that has taken place with regards to that provider. Now, what I do want to say that the service providers that were in place from, the time COVID came about and post-COVID, they were very efficient and they provided a good service.
Yeah.
But I don't think we've assessed this current change, and that's really what needs to look at. So I'm very worried about gender-based violence because I think everybody talks about wanting to address it effectively. Sorry about that. People want to talk about, the need for all these mechanisms to be put in place, but then we don't have a proper monitoring and evaluation system for that. And that's what needs to change is all the ducks have to be, lined up in a row to make this response to violence against women, to gender-based violence, an effective one. And we don't do that. We tend to pick a little bit, pick and choose where we would work around that. And until we get that right, we're going to continue to see spikes in the number of rapes and domestic violence and incest and sexual assault in the country and femicides until we get all of that right.
Dr. Lesley and Forster, let me thank you very much for your time, and perhaps just a parting shot again, using the words of the Deputy Minister who spoke to us. In fact, her description or her characterization of this new service provider was that these people have zero experience for a command center that used to have a package of services to the victims. It's now been reduced to, quote unquote, a switchboard. So those were very worrying words indeed.
Shocking. It's absolutely shocking. And there again, it's a lack of accountability, and we've got to look into that. And I'll move on that immediately as I end this interview. Thank you.
Well, very encouraging indeed. Thank you very much for your time. The Executive Director at Masimanyane Women's Rights International.